How to naturally avoid depression without medications. It is not always possible to prevent or avoid depression, but the good news is that effective treatment is available, and some lifestyle choices can help manage symptoms and prevent a recurrence. Depression impacts how people think, feel, and act. It can also affect physical health and other areas of a person's life. Many individuals take medicine, such as antidepressants, to treat depression, but several natural methods can also assist in managing the symptoms and lower the risk of future occurrence. Depression can happen at any age, and it can affect anyone, but according to the National Institute of Mental Health, NIMH, people are more likely to experience it if they have a family history of depression, have experienced trauma, stress, or a life-changing event, have a physical illness, such as cancer, are using certain medications or other substances. The following may help people who have these risk factors or who are living with depression manage or avoid symptoms. 1. Stay away from stress. There is obvious proof of a connection between stress and depression or anxiety. Individuals who have a susceptibility to depression may have a higher danger of developing it if they have chronic stress. A few group of people are born with genetic factors that increase their risk. Others may develop a susceptibility during childhood, for instance, because of neglect or abuse. In a research conducted in 2012 with veterinary students, it was found that stress had an unfavorable impact on mental health, life satisfaction, and general health. It is not always possible to avoid stress, but taking steps to do so may help. These include getting sufficient rest, figuring out how to say no to extra requests, taking breaks from work, working on breathing exercises and reflection, getting regular exercise, continuously check with a specialist prior to taking any supplements or over-the-counter, OTC, prescription to guarantee it is suitable for use. 2. Exercise. Study shows that physical activity can act as an antidepressant, and experts encourage doctors to include it as a medication. A research in 2018 describes exercise as an underutilized treatment for depression. The authors note that it can boost both physical and mental well-being. Depression can make it difficult for some individuals to start exercising, however, lack of exercise can also worsen the symptoms. People facing challenges in starting exercise could try just 5 minutes of walking or another fun activity in the morning and another 5 minutes in the afternoon. From there, gradually increase over the coming days and weeks. Current guidelines encourage targeting 150 minutes of moderate intensity workout each week, broken into sessions that could be 5 minutes, 10 minutes, 30 minutes, and so on. 3. Diet. A nutritious diet may assist in preventing depression and increase mental well-being. A 2019 research concluded that dietary interventions could play a role in treating depression. Research suggests that the following foods may help. A. Fresh fruits and vegetables. B. Green tea. C. Soybean products. D. Healthful oils, such as olive oil. E. Whole grains. F. Fish. In the same vein, people should control their consumption of the following. A. Red meat and meat products. B. Pre-made baked goods. C. Trans fats. D. Sugary desserts and sodas. Fresh fruits and vegetables provide antioxidants. These help protect the body from oxidative stress and cell damage. According to an article in Antioxidants, processed foods may adversely affect gut microbiota, which could increase the danger of depression. 4. Sleep. According to an article, there is a strong connection between depression and insomnia. A lack of sleep may increase the symptoms of depression, and it is also a common symptom. However, here are some tips that individuals can try to improve their sleep naturally. Sleep and get up at the same time each day, including weekends. Ensure the room is quiet, dark, and of a comfortable temperature. Avoid large meals, caffeine, and alcohol before sleeping. Do physical exercise during the day. Remove electronic equipment from the sleeping area and switch off 30 minutes before sleeping. Get up again if you do not fall asleep within 20 minutes. Read or find some other distraction for a while, then try again. Follow a healthful diet. Stay away from drinking too much fluid too close to bedtime. Limit exposure to bright light in the evening. Other tips include doing breathing or relaxation exercises before sleeping. The 4-7-8 breathing technique can also calm anxiety. Speak to your doctor before using any supplements or medications to ensure they are safe to consume. 5. Alcohol and drug use. The intake of alcohol and some recreational drugs can increase the risk of depression and worsen the symptoms. Many individuals have both depression and a drug use disorder or alcohol use disorder. How the disorders affect each other, however, is not always clear. A person who consumes drugs or alcohol in an unhealthful way and has depression may need help for both conditions. Anyone who has concerns about alcohol or drug use, with or without depression, should speak to a specialist or personal physician who can help. Helplines are available 24/7 for confidential advice. 6. Talking therapy. Psychotherapy, or talking therapy, can assist individuals identify the causes of depression and find practical way out of it. The following options can be considered. A. Counseling for specific issues, such as bereavement. B. Cognitive behavioral therapy, CBT, which can help a person find new ways of thinking and acting. C. Psychoanalysis, which often looks into past issues. Therapy can be one-on-one, with a group of people who meet just for therapy, or with partners or family members. 7. Avoid common triggers. Many factors can trigger symptoms of stress and depression, and these will range between individuals. It may be possible to avoid or reduce exposure to some of these triggers. Triggers that a person may be able to avoid are: A. Exposure to news, some movies, and other media that can trigger depression. B. Using alcohol or drugs, unless the person has a related disorder. C. Having too little sleep due to late nights. If avoiding triggers is not an option, it may be possible to reduce exposure, for example, by deciding on one specific time of day to check emails or watch the news. Other strategies to reduce the effect of triggers could be: A. Asking someone to help out on occasion, for example, if you are a caregiver. B. Joining a support group, so there is someone to talk when unwanted feelings arise. C. Asking your employer about changes in the workplace that may help, such as swapping tasks with a colleague or rearranging shifts. There is no guarantee that anyone can avoid their triggers, but being mindful about them may help find ways to minimize their impact. If you can identify the early signs of a depression relapse, it may be possible to reduce its effect. Don't hesitate to share this video with anyone you know that is at risk of depression. If you know someone at immediate risk of self-harm, suicide, or hurting another person, do the following. Ask the tough question like, "Are you considering suicide?" Listen to the person without judgment. Call the local emergency number, or communicate with a trained crisis counselor. Stay with the person until professional help arrives. Try to remove any weapons, medications, or other potentially harmful objects. If you or someone you know is having thoughts of suicide, a prevention hotline can help. Try to call your local emergency hotline. If symptoms of depression are overwhelming, or if a person is thinking about self-harm, death, or suicide, they should seek immediate medical attention. Thanks for watching. Stay safe and always avoid loneliness. Do not forget to subscribe and like this video.